Yucca Valley is just a hop, skip, and a jump, essentially, away from Palm Springs. But when you're here, you really do feel like you're somewhere else. It feels like it could be a world away. With all the Joshua trees, it's so beautiful to see. There's just such unique architecture and businesses. You see a lot of the local mom and pop businesses. You could feel this small town charm when you're here. It's such a special place here because there are people who have A, actively chosen to move here, B, actively chosen to stay here. People who live in Yucca Valley, I've learned, love living in Yucca Valley. They sing its praises. They have such passion for nature and the outdoors and the fresh air and just living here. And they also have such passion for each other. It's very sweet to see the camaraderie and the close-knit relationships. It's so communal. So even though this episode is about healthcare in Yucca Valley today, I believe the only way to really understand how far it's come is, of course, to take a look at the past and really juxtapose the two, and that is the perspective Dr. Smith was giving us. He was such a staple up here in this community when he was here. Through Dr. Smith, I think we learned how far healthcare has come, growing access, for example, to specialists up here in Yucca Valley. So he really was able to share some of that insight about the growth that happened here over the last few decades. Well, Dr. Smith, something we've enjoyed doing with The Pulse is highlighting so many different topics and aspects of healthcare and also different areas and groups. And we thought we'd want to highlight the high desert, Yucca Valley. Come and talk about healthcare in this area. I understand you were a doctor there practicing for 30 years. It's remarkable.
It may have been more than that.
Yeah.
I practiced altogether 35 years. 55
yes.
years.
What do you love so much clearly about this long career that you've had, looking back?
Well, I just enjoyed practicing and interacting with patients and helping them. I always enjoyed it. I hated to quit when I did, but I was getting to the age where I really needed to.
Who are the people of Yucca Valley? Who lives there? Why do people love living there?
Well, the climate is really good. It's clear
You don't
air.
deal with the valley floor heat, right?
Yeah, it's usually cooler there. And the people are all very nice, very friendly. A lot of them are retired. A lot of them have been there for years. But in the time I was there, obviously, Yucca Valley grew a lot. And people came from Orange County and built a house or bought a house. And so it was really growing the whole time I was there.
What are some of the things that stood out to you in your time working with Desert Oasis Healthcare in Yucca Valley?
Well, they seem to provide services for just about everybody. And as a physician, when I needed something, they'd always provide it. And they were growing the whole time because of the way they treated the patients. And to be friendly to the patients are really important, finding out what their expectations are, what they want from you. Those are things that are important.
I understand you said during your time practicing up in Yucca Valley, you saw essentially a shortage of specialists. How has that changed over the years, to your knowledge, since you left?
I have not been there for about 6 years since I retired, so I don't really know what the situation is. But For instance, when I came, there was no OB/GYN service up there. All babies had to come down to Palm Springs to be born. That's one big thing that's improved. It meant a lot to the community to have that service.
Your hope for the future of healthcare in Yucca Valley is what?
I think Yucca Valley is still growing. That's what I hear from my friends that still live up there. And so I think, just expanding what's already there. The hospital, I think, is adequate right now. So just maybe more physicians and more specialists would be helpful.
For people who live in Yucca Valley, what do they love so much about it?
Everything is sort of together. You don't have to travel a long ways for anything. And just the people are friendly. I think it's just the type of person that moves up there.
The person that wants that sense of community, and then
Right.
That's where they make it. It was really interesting to learn through Dr. Smith's perspective that back in the day, there were not a lot of specialists up here in Yucca Valley, but through Desert Oasis Healthcare and their multiple facilities, they were able to expand that, so there's a lot more access for people up here who need that specialized care.
All right, everyone. Balance class is about to begin. Let's go ahead and stand up behind your chairs. Feet are going to be all the way together again. Hands in the air because we do not care, and sway in the breeze, pushing your hip out to the side, bending your spine.
So much excitement happening in the balance class inside
Yes.
at the senior center. Is there always this kind of a nice crowd?
We always have a big crowd for our balance classes. We have them twice a week on Tuesdays and Thursdays. And we're looking to expand that because we're limited to how many we could have in each class. And so they rush here at 9 o'clock in the morning to get signed in to make sure they can get into that class by 10. So.
That demand just really underscores how big of a role senior centers like this play in so many senior lives.
Exactly.
And I'd love for you just to explain a little bit about who comes to this center, these classes, where do they come from, the age, just to kind of paint that picture.
The broad spectrum of who comes to the classes, as far as age-wise, we have maybe 60-year-olds up to 88-year-olds in there with the classes. Everybody has a different need for the class, whether maybe they're trying to maintain their balance, their mobility, stay active. It does increase quality of life no matter what the age is.
I know you've been here now for 6 years. What role do you see the senior center playing in these seniors' lives? What void does it fill?
Oh, socialization for sure. Many of these seniors here have family that live many miles away, even countries away. And so the senior center is what they have for their daily socialization, whether it's coming here, meeting their friends, meeting a new friend.
I understand a majority of the people that come to the senior center are in a lower socioeconomic bracket, if you will, and may struggle a bit financially. This is all free. Explain the way that this fills that need for people who can't afford to do some other social activities.
All the funding for the programs that happens here at the Senior Center are provided through the town of Yucca Valley, through their Measure Y funding, also through other local nonprofits that donate to our services or donate for different events that happen here. We have the Yucca Valley Senior Club that provides activities for us as well. We have people like Desert Oasis, different organizations.
What role does Desert Oasis Healthcare play in the services you provide?
They play a large role in making sure that these seniors can come here and have an opportunity to take these particular health and wellness classes at no cost, because many of them do not have the ability to pay for these type of services, or if they do have a free gym membership, this type of class is not something that's offered. Statistically, you will see that balance does affect your aging population, especially as they are progressing more onto walkers and canes. Balance becomes a very important aspect in their daily exercise and routine.
You've lived here in Yucca Valley for 25 years. You must love it. It's beautiful. I know so many people choose specifically to live here. What is so special about this place?
I think it's the community. It's the bonds that you build with each other, the relationships that you have within the community, that hometown feeling, that Hallmark community.
It does seem like that.
Yeah,
Yes, driving
exactly.
through, just seeing some of the architecture and the buildings, it's lovely. What are some of the biggest obstacles, if you will, to staying healthy up here? Is it resources?
Resources, maybe in transportation, because maybe some of the resources are miles away, and sometimes transportation can be an issue for that. We're lucky, we do have a nonprofit in the area that does assist in that being, but I would think the biggest challenge maybe would be probably transportation.
Nina's passionate about creating all these different programs and recreational activities for seniors. As far as I understand, they didn't have everything they have now before her time there. She came in and all of a sudden there's all these classes and there's a prom and there's just different activities and programs and resources. And I know she just really cares about these women at the senior center feeling very fulfilled. Yes, there's women and men, but it's predominantly women who come there to socialize, and you could tell she just had a heart for them. So, Vicki, you've lived here now for a few years. What do you think about your time here in Yucca Valley?
Oh, it's precious. I mean, it's after my husband died, it's just a new lift for me, you know. So I have to make use of my time.
You lived in Orange County before this.
Laguna Beach.
Laguna Beach.
Yes, almost 40 years.
40 years.
Everybody was asking me at that time, how can you change the desert from the ocean? Because I love the ocean, and Laguna Beach is far more beautiful and far more busy and active than compared to Yucca Valley. The life is simpler and not too rushed, not too hurried. In Laguna Beach, you're always in a hurry. Here, it's very simple, very simple. You know, even the parties and even the gathering is very simple, and I love it.
You do so much already, but what are your hopes for the future of this senior center?
Well, we'll see our programming increase. We are going to be looking next year into a remodeling. So that may offer extended hours for some of our maybe younger seniors that are still working that want activities for them in the late afternoon or Saturdays. We might see changes occurring that way.
Councilman Abel is somebody who clearly loves living in Yucca Valley. He came here, supposed to be temporary for a year, 30 years ago, ended up loving it so much. He stayed here now, decades later, and you can tell why, right? He's like the fresh air and all the hiking trails and just the access to the outdoors and nature and the great weather. He says there's nowhere else he'd rather live. I just want to start for people who aren't as familiar with Yucca Valley. Who are the people that live here?
Well, the people here are just really welcoming for the most part. Reminds me of the family members and the people I grew up with in the Midwest. They're just really welcoming. Again, it's a slower pace up here in the high desert than it is in some other areas. So people take the time to wave to each other on the road or to see people that you might be familiar with in the grocery store. So it's really a sort of a step back in time in some ways, and it really helps with the quality of life. And so we've seen a lot of transplants coming up here, and it's been really fun being a part of it.
How has your life here in Yucca Valley just even catapulted your health and fitness?
There's opportunities for hiking out in the national park or in other areas that aren't part of the park system. The other thing is that there's not a lot of traffic. So for myself, I'm 65 years old. I run half marathons, 5Ks, 10Ks. And what I enjoy doing is getting out into the foothills, running on some of these trails, and just enjoying the fresh air. Fortunately, here in Yucca Valley, we also have a 12-hole golf course that is a nice outdoor activity. One of the limitations we've had is we really haven't had any kind of an aquatics program. We do get cold in the winter, so we don't have any year-round programming. And I'm really pleased to let you know that we're working on a brand new project. It's going to be an indoor aquatic center, including a gymnasium and some exercise rooms. So then people like our seniors could enjoy year-round water aerobics, water fitness classes, have some more rooms for our balance classes and so forth. And that's a project that's about a $37 million project that we got funding for, and we put it out for bid, and hopefully we'll be breaking ground in this year.
I want to talk more about transportation. I met already just in our time here today a few seniors at the senior center who didn't have cars. They say they walk a lot of places. Obviously, there's public transportation, but as you said, that could only take you so far, literally. Explain the problem.
Yeah, we have all of San Bernardino County is uniquely different. There's the city of San Bernardino, there's other areas that are highly populated. In the high desert, our population is a little bit more spread out. And it isn't financially feasible to get bus routes to all areas. So one of the things we've been trying to do to combat that is to provide people access to dial-a-ride systems. I'm part of the Basin-Wide Transit. We're about ready to celebrate our 35th year of providing transportation to the Morongo Basin. And so we've also raised money and donated vans to our local healthcare and nonprofits so they can go out and get people to and from their doctors as well. We're also providing recently some free bus rides and vouchers. And we're talking about doing a full-time free program for transportation to help alleviate those concerns.
I just want to underscore that for people who might not be aware of this. So if you need to get to a hospital or a doctor and you don't have a car and the bus route won't take you there, how do they access this free transportation from the nonprofits?
Well, they can contact Basin Transit Authority. And if they don't have a dial-a-ride program that goes to their particular residence, they will refer them to the nonprofit that's offering those same programs. So we really want to make sure that people can get those services that they need.
Desert Oasis Healthcare is always so proud to be in communities and put their money literally where their mouth is and be out there, boots on the ground, helping, advance the cause of health and wellness for seniors. And we see that, for example, with the funding of this balance class at the senior center, which we know is so critical. Can you talk about the importance of having that support from Desert Oasis Healthcare?
Well, as a municipality, we can't do all things. So having great partners like Desert Oasis has been really, really instrumental in providing services. For example, the balance class that you got to attend or see, is sponsored by Desert Oasis. And one thing I've learned by being active is that as we get older, I'm 65, things start to diminish, and balance is one of those. And so a balance class is a really important thing because it prevents injuries, somebody from falling. It also helps build confidence. One thing I've noticed, a common denominator with our seniors, the ones I've met, the ones that have stayed independent in their living, the ones who avoid falling and having those major health issues, are the ones who continue to stay active. So for our seniors to continue to be out walking, to be able to go to our balance classes that Desert Oasis provides, is critically important, and it helps build their confidence. So it's really important to have partnerships like Desert Oasis.
In talking to the council member, it became really clear some of the struggles that people in Yucca Valley face, one being that we have to talk about transportation. A lot of people here, due to financial restraints, don't have cars. Add to that, there's not a lot of public transportation that takes them further out. How do they get to their medical appointments? The option is you just don't, right? You don't go, or you don't plan them. You don't put that effort into your health and wellness. There's a lot of nonprofits, which it's wonderful to hear, that are subsidizing that, if you will, and offering free transportation to help these seniors get to where they need to be, all of their medical appointments. But the councilman really highlighted that that is a real struggle for people who live up here. Look, people in the high desert are just the same as people in the low desert. We're all people with hearts who just want to love and be loved at the end of the day. But the difference is what you have access to accomplish all those things in your life, right? And people up here just don't have as much access. So when you see places like the senior center, new funding coming in for this new aquatic center, it makes my heart smile for the people of Yucca Valley who now get that access. Pradeep, you've lived in Yucca Valley for 20 years now. You're a nurse practitioner. I know your family owns multiple businesses up there, and I know you love living there. What are you most proud of?
I think most importantly is the services to the senior citizen. Because it's a small community, the resources are very limited. Number one would be transportation too. There's bus service, but the majority of the seniors are scattered all over. Not just Yucca Valley, we have Landers, Wonder Valley. All those are kind of suburbs of Yucca Valley region. And therefore, the transportation in those areas not so available. If they are member of Desert Oasis Healthcare, we do have transportation services. They need to come visit a doctor or wellness center, immediate care, so they can be set up for a transport. Desert Oasis Healthcare, the services to the senior citizen is the most important there. Also in that whole, not just Yucca Valley, high desert area, from the 29 Palms, Joshua Tree, Yucca Valley, and Morongo Basin on Morongo Valley. So there's only one emergency department. So that's a pretty basic emergency department, but that everything has to be served there. Other than that, there's not any that high functioning urgent care there that can provide basic urgent care services, such as would be fractures, lacerations, and simple wound care, IV hydrations, EKGs, some lab work. There are no other urgent care that I think in that whole high desert that provides that, except Desert Oasis Immediate Care.
What are some other services and programs that DOHC offers up in the area?
I think over there we do have what we call wellness clinic.
Yes.
Yes, so that is for, especially for the seniors, they do provide annual visits. So the providers will see, patients see their primary care doctors. In addition to their regular primary care visits, they're also seen at the wellness clinic. And what the wellness clinic focuses on, make sure the patients are using all the services that they do need, that they can enter into cardiology clinic if they need to, and all their medication they're supposed to be taking, they're on. So that's, I think it's just an extra eye to looking at everything that, every diagnosis they have, that they are getting the services for as well.
I know there's a deficit and a lack, if you will, when it comes to healthcare opportunities and resources for people up in Yucca Valley. Why is it so important that Desert Oasis Healthcare has so many roots out there and is extending its reach?
I have lived in Yucca Valley for 20 years, and I've been in healthcare since then. There has been not a single provider that has moved in that area or established their practice that is independently. So if Desert Oasis is not there, then we won't have any new services coming in that area. So that's where I think the Desert Oasis is so important, because that Desert Oasis is proving to be the only provider there going forward.
To what do you attribute the lack of more resources and more doctors, independent or not, up there in that region?
I think because it's a bit of a smaller community. As for a new young doctor starting a new practice there, there's quite a bit of challenges for them to raise family. I've raised my family there, and it's tough. For anything you have to do, you have to travel down the hill. And the schools are limited, your extra curriculum is limited. So if you want to thrive as a medical care provider, sometimes I have a very supportive family there. So we have extended families, so everybody's there to help, and sometimes, take them to here and there, and we travel a lot, drive down the hill. That's not possible for every family. Other factor also, I like the smaller community, maybe some people don't.
Yeah. I understand you work at an immediate care. Explain the important services provided there for people in Yucca Valley.
I think the immediate care is a very high functioning place there. It's urgent care, immediate care, used synonymously. We are able to provide pretty much a lot of basic testing. For example, in the COVID, flu, RSV testing, strep testing, all their basic lab for their blood work. They can come in, not for routine, but that can rule out any emergent situations. We have x-rays on the site. So for anybody who has injury, can rule out fractures, we can do that. We also can do laceration repairs. We do have a contract with the local hospital's radiology department. So if anybody need a CAT scan, we can order it urgently. They can drive to the hospital, get their CAT scan done, and then we will be able to get the results and plan their care accordingly from there.
You've lived in Yucca Valley for 20 years, raised your family there, you worked there. What changes and evolution have you seen in the last 2 decades when it comes to healthcare?
Yucca Valley has grown a lot. We have seen a lot of expansion in the population. But we have not seen that much medical services came into the area, exception of DOHC. Desert Oasis has brought in their primary care, the wellness center, the immediate care. So that has served that area a lot, and which is, I think, is very positive. That gives people an access to the care that normally they probably wouldn't have.
I could tell you're so passionate about living up there. I appreciate you sharing this with us, and thank you for everything you do.
You're welcome.
Thank you. I think everyone deserves access to solid health care. Everybody deserves the opportunity to be able to get to their doctor. Everybody deserves a chance at companionship and friendship and socialization. And I think it's heartbreaking to think that lack of funding is what stands between some seniors and all the aforementioned things I just said. And Desert Oasis Healthcare really fills a lot of those gaps, providing funding for great resources, not only for primary care physicians to be up here in the Yucca Valley area, but also for the Senior Center to provide a lot of these important resources for the seniors to help fill that gap.